Good evening, friends. We are all very worried about novel coronavirus, and it is, as the name suggests, it is novel. We've not been exposed to this viral infection before, so our immune system is not prepared to fight against it. But we should at the same time not be very worried, as it is like any other flu or viral infection. As the transmission is happening rapidly, that's why the numbers are very high. But by just basic cleanliness, hand hygiene, covering our face while coughing, sneezing, staying away from people who are affected or infected with flu-like symptoms, and avoiding sending our children to school or going to office if we have flu-like symptoms. Like in any other flu infection, we can reduce the transmission of these kind of viral infections. Basically, people who are elderly and very young are exposed to complication related to any infections, and these being one. So we all should just be aware that this is another viral infection by basic hand hygiene, covering our face, eating well cooked food, and wearing masks where appropriate, in the form that if somebody is infected around us, or if we are suffering from severe respiratory symptoms and we feel that there is a risk of transmitting the disease to our close contacts or family members, a mask may help us in preventing that transmission. But the bottom line is that if anybody has traveled to areas where the disease is endemic or epidemic, and or has come in contact with persons who have traveled to that area, should report to their doctor, or if somebody has severe respiratory symptoms, should report to their doctor. So these things would enable us to get appropriate treatment at the right time, thereby also would prevent transmission of infections in and around us. Thank you.